welcome to another episode of Simply Healed. Today we are doing a new topic, not on cancer today, but during our Ask Me Anything session, you can of course ask Dr. Jansen and myself anything, all right? So you can talk about cancer later. But today our topic is dialysis, complications from diabetes and hypertension. First, welcome Dr. Jansen again to another program of ours.
Hello everyone, hello Chan. Glad to be here again and glad to see you again.
All right, it's opening up. I mean, the lockdowns are opening up. The streets are traffic again here in Metro Manila. But let's talk about our topic today. Doc, it's a very serious topic. Let's jump straight into it so that we have more time for the Ask Me Anything or the Q&A session after this. Doc, dialysis. What's so terrible about dialysis? Why should we be concerned about dialysis if we have diabetes and hypertension?
Okay, so I got some information from this website, kidney.org. So here are some of the statistics if you are on dialysis. No? So first, let's compare someone on dialysis and someone who is not on dialysis. So at age 60, a healthy person can expect to live for more than 20 years.
Wow.
Correct?
80,
a healthy person.
All right? 80,
yeah. So everyone, I think, can agree. But if you compare the same person to a person who is undergoing dialysis, okay? So that same person, the life expectancy is closer to 4 years. So you can imagine...
your life is cut short by 16 years.
Crushed down by 16 years, almost like...
Two-thirds.
Two-thirds, yeah.
Wow.
Sort of like a 400 or 400% decrease in...
wow.
Yeah, okay, so that's one of the notable figures. So that's a huge discrepancy. Then those who are 65, at least 65 years old, who has end-stage renal failure, okay? So the mortality rate or the death rate is more than 6 times versus the general population.
Wow. So dialysis is when you reach the point where you actually have to go for dialysis, it's almost like it sounds almost like cancer,
Yeah, even
because you talk
worse.
about 5-year survival rate.
And it's even worse than some cancers. Okay,
It's worse than prostate cancer.
It's worse than prostate cancer. It's worse than colon cancer. Yeah, so it's really something that you have to be afraid of. Yeah.
Yeah, I mean, Doc, just dialysis not only shortens your lifespan, the quality of life is terrible,
Yeah,
right?
it's
Because
terrible,
you can't eat a lot of stuff.
Yes.
I mean, if you are getting away, you're diabetic and hypertension, and you're still eating all the things you shouldn't eat.
Mhm.
If you reach the point of dialysis, there's no way you can bluff your way through anymore.
There are a lot of restrictions when it comes to food. Of course, when you eat certain foods, you have to be wary of your electrolytes as well, because certain electrolytes can shoot up through the roof and you can experience symptoms. Okay.
So, Doc, is there hope? I mean, is every person that's diabetic and having hypertension, are they on a one-way track to become kidney failure with dialysis? I mean, is that the future written in every diabetic person's?
Not really, because if you are hypertensive and diabetic, and you are not really taking your medications, okay, you're hard-headed, okay, or there are just some financial issues. Number one, there are 3 things that can happen. Number 1 is heart attack. Number 2 is stroke, which are practically
Very
the
fast.
same thing. Not really. It's really fast. It's the same thing. It's rooted on the same disease process, but just different location. And the last thing is your kidneys will be destroyed, and you go into dialysis. Okay, so those are the top 3 things that will happen. Yeah.
It sounds like heart attack, stroke, dialysis. It sounds like dialysis is the one that everybody will suffer the most, because heart attack is quick.
Yeah.
So it's a stroke.
Stroke is fast.
Dialysis is painful.
Dialysis is painful. So if in the short term, in the shorter time frame, if you don't get a stroke, you don't get a heart attack,
You will for sure
get
kidney failure.
Get kidney failure. Yeah.
So to our audience later, you can ask all the questions like, are you at risk of getting kidney failure and going for dialysis? We can answer that during the Ask Me Anything segment of our program today, all right? But Doc, what about those of us, okay, first of all, is it too late or is it easy? Is this something very preventable? Let's say we're diabetic now and quite serious, we have high hypertension. Can we avoid going towards kidney failure?
Absolutely. Okay, so here are the simple approach, no? A simple approach. Now, chronic kidney disease is a long-term disease. I think everyone can agree with that, no? But for every long-term or for every chronic disease, we have a short-term solution and a long-term solution. So the short-term solution is to immediately address the pressing issues. So you take your medication. If you have high blood pressure, take your anti-BP meds. Okay, BP lowering meds rather. If you have diabetes, take your blood sugar lowering medications. Yeah, your anti-diabetic medications. Okay,
but don't stop there.
Yeah, but don't stop there because if you just take these medications and you don't do something about your lifestyle, you don't take care of yourself, then eventually these medications will just add one on top of another. Then on some point of your life, another medication will be introduced by your doctor.
In fact, Doc, we have a program 31st of March, which is next week, on what's the long-term effect of maintenance meds.
Yes.
Right, so we'll cover that next week. So tune in next Thursday to know what are the long-term side effects of the meds that you are taking now.
Yeah.
So Doc, how's your, so you are very confident that if a patient comes to you, they're diabetic and it's serious, they have hypertension, you have protocols that can prevent them from dialysis.
Absolutely. So that comes in the long-term management of chronic diseases. So when I say long-term management, that is lifestyle change. Okay, so you have to change the way you eat, the way you do physical activity. If you are not exercising, then you have to move. No, your sleep, your stress management, okay, those stuff, lifestyle. And another thing is, we have to expedite this process.
Make it faster.
Yeah, make it faster. So this is where Simply Nature PPARs comes in, okay? Because Simply Nature PPARs is sort of like, the gasoline to your
the nitro,
yeah, the nitrous oxide to your engine, so to make things faster. Okay, so that's why for every patient that I manage, for every metabolic patient that I manage, I always use Simply Nature PPARs to help expedite things. But at the bottom of it all,
it can be solved.
Yeah, it can be solved. Okay, these things can be reversed early on.
So
okay?
don't ignore your diabetes and hypertension. Don't let it become that very life-threatening and death sentence, which is kidney failure and dialysis. Now, Doc, here's the next thing. I mean, some of our listeners can really feel about the pain you're talking about because they are going through dialysis. Is there any hope for patients who are already on dialysis?
Yeah, there is, of course. So I have managed certain patients who are on dialysis who have been able to reduce their sessions.
Oh, so these are your patients?
Yeah, my personal patients. Okay, and in terms of how they feel after the dialysis, it's really better versus when they were just starting. Then it's all because of Simply Nature PPAR. So it makes the patients more energetic as well.
So your patient moved from 3 times a week to
twice a week.
Wow, that's good news.
So we are now continue to monitor this patient. Hopefully, she can go once a week dialysis.
Well, that would be a great help to her and her family.
Absolutely, but we keep working together with her nephrologist. So it's the nephrologist who has the go signal. So my role with her is just to try to guide her on the right path.
You're like a guardian angel,
showing her the way. Showing her how to the foods that she eat. Make sure that she takes the PPARs tablets. Yeah, so that's where I come in, because some patients would think, okay, if I go into dialysis, it's very difficult, it's very taxing to the body. And also, not just the physical health, but also financially.
Yeah.
So the question is, if I go into dialysis, would it extend my life? Yeah. Okay. Would it extend my life?
Is it worth doing?
Worth it?
Is it worth doing? Yeah.
Now, just so you know, the average life expectancy of those who are on dialysis is 5 to 10 years. Now, some patients, actually many patients, can actually go on dialysis for the next 20 or even 30 years. Okay, so definitely, there's some value in it because dialysis would definitely extend your life.
Because
Okay?
if you don't do dialysis,
Yeah, you'll die
you die
the
like
next few
next few days.
weeks,
Yeah.
next few months probably, no? Okay, but in terms of the survival rate, okay, do people actually are able to survive? Now, this is another data, no, from kidney.org. The 5-year survival rate for a patient undergoing long-term dialysis in the US is approximately 35%. And if you are diabetic, it's approximately 25%.
So only 1/4 of the people make
yeah.
it past 5 years.
Yeah, but you can just imagine if these people don't undergo dialysis, then it would be
zero.
Almost zero. Yeah. So there's some value in it. So I would encourage you to go on dialysis, continue. But also, if you experience some difficulties, I mean, you are so weak, go for a consult. So I can help you, survive dialysis, make your quality of life better.
Doc, hearing what you say is very encouraging. So any of the listeners in tonight's program, if you have a loved one or a friend who's undergoing dialysis, I guess many times, Doc, I in Singapore, we keep having these fundraisers on TV for the dialysis, the Kidney Foundation for Singapore, because many people, it's so expensive that a lot of charities support these dialysis centers. And in my mind, it always seems like it's an inconvenience. You suffer, but you get to live a long life. But today I realize that's not true. Most people on dialysis don't make it past the 5th year. So I think that's a big wake-up call for those of us who are on track to kidney failure because of our diabetes. Please make a U-turn, right? There are many things that we can do. And the great news is it's not difficult. It's actually quite easy to turn around. And for those who are on dialysis, amazing testimony from sharing from Dr. Jansen to be able to reduce from 3 times a week to 2 times a week and aiming for 1 time a week. It's possible that by doing so, you actually, instead of 5 years, 10 years, right? Or 15 years, because you reduce the number of times you're going for that dialysis. So, Doc, I also wanted to share, this is a Hail Mary pass, right? Which means it's a chance that you can try, right? So we actually have had many patients, we have had patients, right, who are on dialysis that actually reverse and go off dialysis. And all these patients, they develop kidney failure because of diabetes. So I think it's because PPARs is able to reverse diabetes and give the kidney a chance to actually recover. So it's good news and even better news. The good news is if you're on dialysis, we can extend the effectiveness of dialysis so that you can have a fuller, more energetic life. And that the better news is that there is a chance, all right, case by case basis, you can possibly even reverse your dialysis condition. So kidney failure condition. So, I think, Doc, at this point, I see the questions flooding in already. So we're going to go to the next section, which is Ask Me Anything. But before you ask any topic that is not kidney or diabetes or hypertension related, please let's start with those questions. And then after that, you can ask anything you want, from COVID to cancer. But Doc, thank you very much. I think tonight, what I got out of it is don't ignore your diabetes, your hypertension. Dialysis, kidney failure is just as deadly and dangerous as like cancer. And the good news is it can be reversed. There is a possibility if you are already on dialysis, and your quality of life can definitely be improved. So thank you very much, Doc.
Yeah, thank you, Sean. Thank you, everyone, for listening. So I'll see you in the Q&A.
So we'll go to the Ask Doc Anything.